I'm gonna say that it's starting right now, so I present my mom.
Hi everyone. He is an important part of my presentation and why I'm here today, so I thought who better to introduce me than my son, and my entire reason for standing up here today. So first off, I want to thank everyone for being a part of this and actually taking time out of your incredibly busy life to be here and prioritize health, because as I noticed in life, and I'm sure many of you have, if we don't have our health, we really have nothing, right? We don't have the ability to work, we don't have the ability to pay our bills, we don't have the ability to enjoy time with family. So this is why I started this event. This is our second annual event, and we're really excited to be here. We have some amazing, amazing speakers today. And my goal with the ReThink Health Summits, is really to get people to open their eyes to the fact that there are a lot of alternative solutions to health, right? Because we're brainwashed from a young age that when you have something wrong with you, there's only one option. You go into the doctor's office, and that doctor pretty much is like a god, is never wrong, and you don't question them, and that's it. Whatever they give you, that's your only hope. And what I realized when working in the pharmaceutical industry and calling on thousands of doctors every year, all types, I called on pediatricians, cardiologists in the hospital, orthopedic surgeons, family practice doctors, all across the board. Really, they are not God, that's for sure. And there's a lot that they don't know and that they don't learn in medical school. So I think that there's a real great trend going on where people are starting to open their eyes and understand that health doesn't always happen inside a doctor's office. And there are a lot of alternative solutions that doctors may never tell you, because that's not how they make their money. And that's not what they learned in medical school. And we have a great doctor. Well, yes, because don't just believe me, right? We have a great doctor who's going to come up next, Dr. Jim Meehan, and he's going to tell you the truth and the reality about the medical system and what doctors do and don't know. So my goal with this event is to get people real solutions to help improve their health, to help heal their health, to help maintain health, and really think about things in a different way. Because really these days, to create real health in our lives and in the lives of our families, we have to think outside the box that we've been put in and told not to question. And I learned that firsthand, and I'm going to go over that in a second when I share my story. But I really want to thank every single one of you today, because you are the people that are making this change in the world. The speakers that we have today are going to blow your minds, and they're going to give you amazing solutions. But you guys are going to take that outside in the world, and you're going to improve your health and the health of everyone around you. So thank you for prioritizing probably the most important thing in life these days, and that's our health. And hello to all of the live stream viewers, because we have hundreds watching live stream right now from around the world, from South Africa, from Europe, from Australia. Well, they may be replaying in Australia. But anyway, hello to all the live stream viewers. Thank you for joining us as well. So, sorry for the late delay as well. We had a little technical issues with the live stream, but I think everything is on par right now. And thank you to my amazing assistant, Laura, here, who is a whiz and who had an incredibly difficult challenge this morning and last night figuring out the live stream. And she's done miraculous things, like always. So, your health for sale. Yeah, it's not a pretty subject, but I thought I would start the day with a power pack, right? And just blow your minds right away. Maybe not in a good way, but as I always say, the truth will set you free, but first it will piss you off. I'm sorry, and I'm sorry to be the one to tell you that, but that's the truth. And you know what? When I stepped into the pharmaceutical industry, I had no idea what I was getting myself into. And it blew my mind, and it really pissed me off when I figured out the truth. And fast forward to today, that's one of the reasons why I'm standing here today. So, Why am I really standing here today? Well, you guys saw him, my amazing little boy, Bastion. I'm here because the world is sick, right? I mean, sick is the new normal in the US. We have, across the world, but particularly in the US, because for some reason, the capitalist system really gave the medical and pharmaceutical industries huge control over our healthcare system, over the government, over health insurance, all of this, right? Over our lives. So, sick is the new normal. In fact, it's really hard these days to find someone who doesn't have some health issue. And half of the people will tell you they're perfectly fine and healthy. They just have 3 medications for anxiety, depression, and asthma, but they're perfectly healthy. And why will they tell you that? Because these days, it's normal to be sick. It's not normal to be sick, right? And after working in the pharmaceutical industry, I went to Europe. I moved to Europe, and I lived in Amsterdam, where people do health differently over there, right? And they really rely on natural health, homeopathy, herbs, good nutrition, exercise, and they rarely go to the doctor's offices. And it was mind-blowing for me, right? But I realized there was a different way of doing health, and that sick is not normal, okay? Sick is definitely not normal. And we need to change our perspective on health and sickness in the US, or we're all gonna get cancer and die. I hate to break it to you, but that's what's gonna happen. So, today we're gonna give you lots of solutions to make sure that that doesn't happen, and if it does, you're gonna look at it not as a death sentence, but as something, as a warning sign, as a red flag that you need to change some things in your life. And it's doable. And we're gonna hear from some amazing stories today, not just for cancer, but other health issues as well. And it is feasible, it is possible. We'll have people in this room that have done it, and it's gonna be amazing. So, we don't have to be sick. It's not normal, and we don't have to accept it. And why am I here again? For him, because what kind of legacy are we leaving, right? What about his generation? They are going to be so drugged up, and they already are, even in childhood. They're going to be so drugged up and so sick that, I mean, ultimately, not only this generation, but where is humanity going, right? I mean, are we killing ourselves off as a species for greed? Because there are big industries that don't really care about our health. They care more about their bottom line and their profits. So, this is why I'm here. So thank you, Bastion, for introducing me. You're amazing. So most people tell me I'm a bit crazy, right? Because I speak out. Thanks.
You're actually helping the world.
Oh, thank you, my love.
Not being crazy.
Yeah, I love you. I promise I didn't pay him to say that. And I am a bit crazy, right? People say I'm crazy because I speak out against a very, very, very powerful industry that I used to work for. And as you can imagine, they don't play nice with ex-employees, right? That speak out. And they have all the money in the world, let's just face it. And I don't. And, you know, there are a lot of ways they can make your life very interesting when you do that. So I am a bit crazy for doing this. But as Steve Jobs said, the ones who are crazy enough to think they can change the world are the ones that do. And so that is why I'm here today. And thank you for all being a part of that. So, how did I get here? How did I end up working in the pharmaceutical industry? Well, back many years ago, I'm not going to tell you how many, no matter how much you pay me, I worked for Merck. So I started in the pharmaceutical industry, and I actually, what was that? I actually thought that I was doing a good thing, right? Because I was raised in the normal American family, actually partly raised in Oklahoma, 5th generation. Dr. Jim knows what I'm talking about. And you follow the system, you become a doctor, a lawyer, an engineer, or a teacher, basically. That was the mindset, that was the mentality. And you don't question things. And everything, doctors say are it. So when I went into the pharmaceutical industry, I was, thinking like much of the world does, oh, I'm saving the world, I'm helping people that are sick. And I had 3 offers, job offers, and I chose Merck because, to be honest, they were the good guy of the pharmaceutical industry. That was their reputation, and they had a program for river blindness in Africa, and it was important to me that the pharmaceutical company that I worked for was giving back. I was brainwashed, like much of the US is. I wasn't brainwashed for very long, because it was a huge wake-up call. One of the drugs that I sold was Vioxx. Who remembers Vioxx? Oh, good. A lot of you in here. It was a very, very powerful pain reliever that was so powerful it caused heart attacks and strokes. And it was on the market for 5 years. When things started to go south, when the Merck started to get some questions from the FDA about their studies, we were already touting a study that had been going on, and the 2 doctors, us as salespeople, we were already touting the study, and then all of a sudden, the study got stopped. And you weren't allowed to talk about it anymore. And we went into emergency meetings where we had to role play what to say if the doctor says, is Vioxx really killing people? For anyone with a little bit of critical thinking skills, that kind of wakes you up, right? And you think,
It kills you.
you think, what really is going on here? So it woke me up to the fact that Merck actually knew what was going on. And in the study, before Vioxx was even released, they focused on one area of potential efficacy while ignoring the fact that heart attacks and strokes were 2 to 4 times more likely in the drug group in the trial than in the placebo group. So the study was stopped, and Merck did everything they could to keep that drug on the market as long as possible. It ended up being on the market for 5 years. Merck made $10 billion off the drug. When it was pulled off the market, they paid out $1 billion in fraud to the US government for lying about the drug, and $5 billion to families that lost people to heart attacks and strokes in a class action lawsuit. They still made $10 billion. It was still a good business investment. Shocking, right? So, it was the largest drug recall ever at the time. The FDA says officially 50,000 died in 10 years, 10,000 a year. Others say up to 500,000. And those are mathematical, statistical people who did the numbers for the death rates in those 5 years. What happened? How was this drug even approved on the market? I left Merck before the drug was even pulled because I saw what was going on, and it really disturbed me. And it disturbed me so much that I left the industry completely, and I became a writer, a marketing writer. And then I moved to Europe, and I really saw how things were done differently. But when I came back from Europe with my son and seeing how sick his generation was, I felt really compelled to speak out and wake people up to the fact that the pharmaceutical industry really is not putting patients before profit. It's really all about profit for them in so many different ways. So, the pharmaceutical industry does not create cures. They create customers. That was the biggest takeaway from my years in pharma. They create customers, right? So when you go into that doctor's office and the only tool that they learned was to, look at a good book and say, okay, symptoms might match these 20 diseases. I'm gonna take my best guess, and I'm gonna point at one, and tell you have that, put you on 3 drugs, and send you out the door. And then you're gonna come back with side effects from those 3 drugs, and I'm gonna write you even higher prescriptions of those drugs, or more drugs, to handle the side effects, right? These are the tools doctors are given. And I saw it firsthand when I called on them. Because I think most doctors get into it with good intentions, right? But they just don't know. They spend hundreds of thousands of dollars being told that this is the only way you do things, and this is all they learn. And they don't like to be questioned about other things because they don't want to look like they don't know, right? Nobody wants to look like they don't know what's going on, especially if you're paying them to say something to you, to try to give you a solution. But they're working for the pharmaceutical industry, really. Essentially, they were much like I was, a pharmaceutical salesperson. I was just giving them what to say to the patient. I would go in and tell them what to say to the patient. And then I would stand in the hallway and I would hear them repeat word for word what I would tell them to their patient. Not all doctors are like this, and Dr. Meehan is definitely not like that, and we have others coming later this afternoon that really have come outside of that box. But most are trapped in debt, and they can't afford to have you question them. They can't afford to lose patients. But who's the one who's taking the hit? It's the patients. It's everyone in here, every time we go in. So it's up to us to really rethink how we do health, and that's why we're here today. So, they create customers, right? Pharma makes money keeping you sick. I know this is probably one of the hardest truths that anyone can get their head around. But they do not become one of the largest industries in the world by keeping you healthy. Because what happens if you're healthy? You're no longer a customer. They make money keeping you sick, to keep you on a cycle where they create the illness in the first place, and then they give you the solutions, right? And then those cause side effects, and then they give you more solutions. That's how they become one of the largest industries in the world. They don't make money off healthy people. If everyone in the world could get this in their head, I think we would have a revolutionary change in the way people see health. And that's my goal. It's $1 trillion industry, and it is growing. In just the last, this is from 2016, these are the last numbers, but it is almost quadrupled, okay? It doubled in size in 10 years, from 2006 to 2016. The pharmaceutical industry doubled in size in 10 years. Do you know how many customers they have to do that? That is shocking, right? Shocking. So clearly, there is something very, very wrong with our healthcare system. And I don't want anyone else, when you leave today, I don't want you ever to call it a healthcare system again. It's a sick care system. It is a sick care system. You can call it the medical system or the sick care system. No longer, you're banned from using the word healthcare. Because it's not healthcare. Sometimes people speak the truth. There was a pharma CEO of Valiant Pharmaceuticals who actually, in an interview in 2015, said, "We're in the business of shareholder profit, not helping the sick." Come on, guys. They're fooling you. It's right in front of your eyes. And when they speak the truth, what do you think happened to this CEO? How long did he stay after that quote came out in the media? Not very long. He had a great retirement package to the Caribbean within 2 months. And guess what? They're doing a darn good job of it. I hate to say it, but you saw that number, the doubling of the pharmaceutical industry in 10 years. We are far sicker than most developed countries here in the US, despite spending more per capita on healthcare, sick care, I'm gonna call it sick care. We spend more per capita on sick care than any other country in the world. Any other country. And yet we have the least effective. Once again, US has the most expensive, least effective healthcare system in the survey of developed world. Least effective. So clearly something's wrong. I know I'm kind of pounding this into your brains, but I have to give you guys things that you can go outside this room and tell your friends and tell your family. Because so many people are still being dragged into this system that is keeping them sick. So how are they doing on their quest to keep us sick? Oh gosh, this is the slide that should piss you off the most. These numbers, they're even more at this point, I think. Yeah, it's about 1 in every 2.
1 in 2 men,
Well,
1 in 3 women.
Yeah, 1 in 2 men and 1 in 3 women. I can't even keep up with the statistics. Are going to get cancer, right? But you don't have to. And I'm going to do a second talk today, and I'm going to give you some real solutions on how to detox your lifestyle, on what to do, and things like that. And then everyone else, all the practitioners in the room, are going to tell you specifically, disease-wise, other solutions. So, 1 in 12 women, this is now 1 in 10, women have an autoimmune issue. I mean, who knows someone with lupus, chronic fatigue, fibromyalgia, these things? Did you know anyone 20 years ago with this? No. What's going on, right? Gut issues. 60 million have allergies and 30 million have asthma. Can you even imagine how much money that is worth to the pharmaceutical industry? Dementia, Alzheimer's, MS, diabetes, lupus, all skyrocketing. The US has some of the highest rates of chronic illness in the world. 1 in 3 people have a chronic disorder. This is how sick they've created, and this is how they became a $1 trillion industry, right? On the back of your health, and your family's health, and your children's health. But we're not going to put up with it anymore, are we? Not after today. Oop. Medical science has made such tremendous progress that there is hardly a healthy human left. Aldous Huxley, read all his books. He was brilliant. He foresaw this almost 100 years ago. Incredible, incredible. Just as the pharmaceutical industry was beginning, the 1930s, he wrote about this. So the system is focused on treating symptoms with drugs and medical interventions, but ignores the cause of the problem. So this is the number 2 thing I want you to take away from this talk this morning. They never address the cause of the problem. So while they may be able to disconnect your body, basically by numbing your body with a drug, so that it cuts off the synapses between the nervous system and the brain, so you don't feel the headache, but it's still there, okay? You don't feel the pain in different areas, but it's still there, and it will only get worse. And that's why your body gets used to certain amounts, and you have to usually go on higher and higher doses of the drugs, because the pain is still there. The drugs never address the root cause of the problem, and that's what we're doing today. Is we want to get really to the root cause of the problem. And I'm going to go over this in my second talk this afternoon. I don't want to give it all away. But most disease is caused by overtoxicity in the body, which causes chronic inflammation, or a nutritional deficiency. These are the 2 things that are probably responsible for 95% of the disease in the world. But they won't ever tell you that, because guess what causes toxicity? All of the chemicals that are in the drugs, in our water system, all of these things. And I'm going to give you real solutions to avoid some of those things later. So I love when the media actually comes after the pharmaceutical industry and speaks some truth. And this was from the Huffington Post. Drugs you don't need for disorders you don't have. And no, the slide's not blurry. That was how they did the image. I love this because this is exactly it. And the subtitle of the article, Inside the Pharmaceutical Industry's Campaign to Put Us All to Sleep. They want us to be asleep to the fact that they are a sick care system and not a healthcare system. Drugs you don't need for disorders you don't have. I mean, I think I could just end the talk right there. I don't know, what do you think? But I'm not going to, because I get questions all the time. You know, how has it gotten this way? And what about the FDA? And what about these things? And I'm going to go into that quickly in a minute. America on drugs. 60% of Americans are on prescription drugs. I believe it's 70% now. 15% or more are on 5 or more drugs. That was a JAMA study. The average American fills 12 prescription meds a year. Most fill way more than that. Prescription drugs are now the 4th leading cause of death in the US. I'm going to get more into this in my second talk. Oh, should I give away the punchline? I will talk about how, if you really look at it in the overall picture, the medical system and pharmaceutical industry lumped together are probably the leading cause of death in the US, by far. Prescription drugs alone, and this is correctly labeled, correctly taken, prescription drugs are the 4th leading cause of death. It's incredible, and people just take it like candy. So, are these medications keeping us healthy or making us sick? I don't know. What do you guys think after my first few slides? I think we all get it now in here. But it's your job to get out there and tell everybody else. So, But medical school, Brandy, doctors know everything. You know, all of this. I get this all the time. The indoctrination starts early. So back in 2009, 200 Harvard medical students demanded pharma out of their medical school, right? They had reps in there, they had people, consultants, academia on the bill of pharma coming in and talking to them about different drugs. Guess what happened? Yep, nothing. Absolutely nothing. Nothing has changed. Big money in medical research. Nearly 75% of all scientific safety and efficacy studies on pharma drugs are paid for the company. Whether it talks about it or not, whether it's admitted, there are ties. And you know those other 25%? You never see them published. Studies that show any negative effect are often manipulated and or stopped completely. Does not have to be reported to the FDA. So Merck can stop that study that shows death and heart attacks in the Vioxx group, and they do not have to report it to anybody. They just stop it. And there was a great report out of the Canadian government last year, I believe. 45% of studies that are funded and begin are never published. Think about that. So much of scientific research just does not get into mainstream media for sure, does not even get into academic journals unless it favors the company that is paying for it. So, 80% of all meta-analysis studies had industry ties for the antidepressant studies. 10% were not even disclosed. I mean, this is incredible. But just don't believe me, right? Just on the face of it. Dr. Richard Horton, he is the current editor-in-chief of The Lancet, one of the most prestigious medical journals in the world. And he said, the case against science is straightforward. Much of scientific literature, perhaps half, may simply be untrue. Untrue. And you know, there are multiple medical journal editors coming out saying the same thing, including Marcia Angel, who has a great book called, basically, The Myth of the Pharmaceutical Industry. So what else Dr. Horton says in his quote, you can actually, I have the link at the bottom if you want to look it up. Science has taken a turn towards darkness. So medical science can no longer be relied upon. But who is making decisions based on it? Your doctor. But the only medical science he really has time to read is what the pharmaceutical reps put in front of him. So, what about the FDA? Well, the FDA is so corrupt. It's a revolving door with the pharmaceutical industry. So it's same with the CDC, same with the NIH. And I've done some research on how this actually happened. And back in the Reagan era, the NIH was allowed to start collaborating with private companies, with the pharmaceutical industry. So their patents, which are licensed to pharmaceutical companies, and NIH scientists make royalties and millions off of them, then they actually could collaborate together on different projects. And it completely corrupted the National Institute of Health, the NIH, which is where most of medical science, government funded, comes out of. So this is no longer, the agencies are no longer independent. 30, 40 years ago, yes. Now, no. So a revolving door. If you behave at the FDA or the CDC or the NIH, you can get a really, really cozy job at pharma. And Julie Gerberding, head of the CDC, was one of the prime examples of this. She left the CDC. Within 6 months, she was cashing in $3 million in stock options. She went to head up Merck's vaccine division, right? It's a revolving door. If you don't behave, you get kicked out of the agency and you get blacklisted. And everything that you've worked hard for, all of the studies you've done, are completely, basically you have no job and you have a lot of bills to pay. So, pharma spends more on marketing its products than research and development. Because I hear this all the time too. Oh, Brandy, but pharma needs to make all of that money because they have really high research and development fees. Oh no, they don't. Research and development, it takes a back seat to marketing, right? So they spend more on marketing than they do in R&D. And it's not just consumer marketing. So you see the, what is it, like 20 pharma commercials per hour on TV? You see that? That's a third of what they spend on marketing to doctors. In conferences, in webinars, in the reps visiting their offices, all of that. Marketing is their business, not R&D. And any R&D that's going on, most of it is, again, to treat symptoms and not the root cause. Some studies show that pharma spends 6 times more marketing their products. If you combine what they do consumer marketing as well as to doctors, 6 times more than research and development. This is not an industry that cares about your health. They care about you being a customer. Why do you not hear this on TV? Oh, because the US is one of only 2 countries that allows direct-to-consumer marketing on TV from pharmaceutical companies. So you see all of these beautiful people running around on the screen with their dog, chasing them through the grass, they're living a healthy life, they have no pain. I guarantee that person is not on that pharma drug that they're pitching. I guarantee it. So they're the second largest advertiser. The pharmaceutical industry is the second largest advertiser on TV. So you're not going to hear this on mainstream media. You just aren't. Because they will never bite the hand that feeds them. And you know what? I'm not going to say never. Because there are some, like the Huffington Post article, there are a few times that things come out, right? And the mainstream media did talk about the fact that the US has the least effective healthcare system and the most expensive, right? I have those slides in there. But the majority of time, they won't. And when they do, it's very overreaching, right? And it's very balanced. The spokesperson for the pharmaceutical industry will have his comments in there everywhere. Doctors will be, oh, well, we can't really take these results as the end all. These drugs are very helpful for a lot of people. These kind of things all over the media quotes. But that is not where you're going to get your information. It's just not. That's why we have to have events like this. So, listen, honey, you're not fooling anyone. That's what we're talking about pharma today. You are not fooling anyone. And it's time to take back our health. So what do? Now, I'm giving you a little snapshot of what I'm going to talk about a little bit later, but the Mayo Clinic website, they push a lot of drugs on there, but at least they have some things that are really honest and truthful. Cancer is a mutation of genes after birth, most often due to environmental toxins. Smoking, radiation, toxic chemicals, I'm going to talk a lot about that later, pollution. Autoimmune disorders, most due to environmental factors. This whole genetics, oh, it's in your genetics, you got cancer from genetics. You can't get cancer from genes, okay? Our genes are not like ticking time bombs in our body. They only are if you're exposed to environmental pollution and chemicals that our bodies cannot process, synthetic chemicals. So, these things, we have to take back our own health. And it is not genetics. It really isn't. But it's up to us to change it. The best defense against disease, a healthy, strong immune system not overloaded with toxins. Period. You need to detox and you need to heal. And I'm going to talk a lot about that later. And we have amazing practitioners that are going to speak today on different ways to do it and give you real solutions and tell you really amazing stories that I guarantee are fact, not false. So, the system is focused on treating symptoms with drugs. I put this in here, not a mistake, I put this in here twice because we really need to get this through your mind as you walk through today, right? Because you're going to hear some, again, amazing stories that are real, and they can be the reality for more people if more people will wake up and step outside of the system that's keeping them sick. There's no magic pill. Our health is in our hands. It really is. I know it takes a lot of work on our own, but 60% of bankruptcies are now from medical bills. So I know it takes time, and I know it takes a little bit of money, but there's nothing more important than your health. All right, I love this slide. I want you to rethink health. That's why I started this event. Thank you for being here. And I'm going to go through more of this later in my other talk. We need a lot less of this and a lot more of that. We have to step outside of the system take back our health, and create a new system. So this is what today is about, creating a new system that we all can enjoy and we can all use to create our healthier lives. And then we have to change the lives of others. So your family, your friends, everyone who can't be here today, it's up to you to bring this information to them. Because we have to be the change that we want to see in the world. And it's up to all of us. Because so many people are blindsided by the media and blindsided by what they're supposed to do and what we've been taught all our lives. We are the ones that have to wake them up. So thank you for being a part of that. And thank you for being here today.